The National Center for Disaster Preparedness, based out of Columbia University's School of Public Health in New York City, is dedicated to investigating catastrophic scenarios with the mission of crafting policy and analysis from a public health perspective.
Working with our staff at the National Center, particularly Dr. Abramson, we decided we would see how the elusive communities, or communities that are most difficult to track, would respond to public health messages. And to do so, Dr. Abramson wanted to focus first on people who are immigrants of varying types of legal status.
And essentially what this research does is, without having to shine a spotlight on a given individual, it gives that community a voice. And it's a voice that's often not heard, is very important to be heard in the public health community and in the larger political realm as well, to be sure that people know that, you know, you have to care for everybody. That's just the sort of the public health model.
Well, that's good to know, and I'm hoping that Lorena, the team in Florida City Homestead, that information, one of the reasons I asked is so that as we approach the families, they don't look at it as, oh no, I'm going to be on the 6 o'clock news in a gotcha segment.
There are several objectives that we have with this study. The first one was to see whether it was even feasible for us as an academic research team to go out into this community across the country in different sites, find people who would be willing to talk to us, and really engage people in a way that we would get candid responses to our questions about how they perceived public health messages. The second objective, and this is really the substantive one, is to have a better understanding of how these communities respond to public health messages, what kind of health-seeking behavior they engage in. In other words, where do they go for care? What are the issues that they face? How do they think about any number of issues on a day-to-day basis that will really be important for public health to be thinking about? So that in that case, the objective is looking at something like swine flu, H1N1, or any kind of pandemic. How does public health and how do these types of governmental agencies reach into the communities in a way that makes sense, that is accessible, that can be understood, and that can be trusted?